Okay, so allow me to call these 4 countries, that's only to represent African Union. First is Dr. Seydou Ouattara from Burkina Faso. Can I have you here? May I also call Dr. Manaouda Malachie, Minister of Health of Cameroon. Please join me, please, here. May I call also Dr. Jan Root, Minister of Health of Uganda. Yeah, take a seat, please. And Dr. Kalumbi Shangula, Minister of Health from Namibia. May I have 4 of you to be here? That's only to manage our time. Take a seat, please. Yes. Okay. So you have a mic with you. So there is 3 questions. How do you see hepatitis as a health problem, priority in your country? The second question is, how can international collaborations help the national hepatitis program in your country? And how do you think the Forum of United Nations group of friends to eliminate hepatitis? This is the 3 questions for each of you, but I'd like to tell you that you have just 3 minutes. I'm not here to limit you, but the time is not with us. Okay, so can we start with Burkina Faso, please? Okay.
Thank you. I'm Dr. Seydou Ouattara from Burkina Faso. We are delighted to take part in this important meeting on hepatitis. In our country, hepatitis is a real problem, ill problem with around 10% of population carrying the virus. Also, in the health service, the frequency of primary liver cancer and cases of chronic hepatitis also remains very high. Different strategies take place, including the introduction of hepatitis B vaccination into the national immunization program, the acquisition of anti-hepatitis drug for case management, and implementation of a national hepatitis control program. I think the international collaboration could help the national hepatitis program to run effectively the national plan as the country has limited resources. There is a number of challenges, including raising awareness, drug supplies, staff training, and restrengthening the laboratory for diagnostic. All these elements are point of support to the national program. These forums could help the elimination of hepatitis in the advocacy for mobilization of resources, the reinforcement of the national program of elimination of fight against hepatitis because the program is really new, but also for the reinforcement in equipment, as well as in training medical and lab staff and awareness of the population. No, thanks.
Thank you so much, dear colleague. May I call Honorable Minister of Cameroon to share with us also their experiences on these points. Thank you.
Thank you very much. Let me say first that it is with great pleasure that I take the floor on this occasion to add the voice of my country, Cameroon, to the other voice, a United Nations, in this matter of advocating for the elimination of hepatitis in the world. Let me give some data for the Cameroon. Up to now, we have 2,800 people test positive for the hepatitis B and 3,786 for hepatitis C and 423 people developed post-hepatitis liver cancer. So I think Cameroon, in this view, has developed some programs, like including this fight against hepatitis in our universal health coverage. In terms of care, the government action are follows. To date, 19 approved treatment centers and 2 dispensing centers have been made operational throughout the country. We have reduced about 82% in the overall cost of drugs to treat hepatitis C and 60% in the cost of drugs to treat hepatitis B through the subsidizing mechanism. All this confirms that the government is determined to facilitate access to this care and bring it closer to the people. We are planning to, as I said earlier, we are planning to integrate this fight against hepatitis in the treatment into the universal health coverage in our country. I think the most priority up to now is to mobilizing the financement of this to fight against this pathology. This action through beneficial suggests the need for the other action, particularly information, education, and awareness raising campaign on the prevention and treatment of hepatitis. Furthermore, taking hepatitis into account in the management and monitoring methods for the Solidarity Fund for the International Drugs Purchase Facility offers the possibility of subsidizing viral load tests for hepatitis in the near future and would certainly reduce the cost of healthcare for households. So, ladies and gentlemen, allow me to conclude my retainment. Once again, the consent action we are taking to achieve the elimination objectives, namely stepping up prevention, mobilizing for vaccination, encouraging voluntary screening, adopting safe sexual practices, practicing safe medical care, and lastly, extending vaccination coverage against hepatitis B. This is the price we will have to pay to safeguard the gains so daily made over the years and at great sacrifice. That's the experience of the Cameroon, my country. Thank you for your kind attention.
Thank you so much. Honorable Minister, may I call the Permanent Secretary of Ministry of Health of Uganda to take the floor, please.
Excellencies and distinguished delegates, thank you very much. We want to appreciate the UN friends who convened us today. Hepatitis remains a big global challenge. You have had the global picture, the continental picture in Africa, and in Uganda, our prevalence of hepatitis still stands at 4.1%. Hepatitis C, we don't have the data, but we use the data in blood bank screening that stands at 1.5. We have introduced the birth dose. We used to use also the adult dose that we introduced routinely in 2002. That stands at 90% the coverage for all the children. However, the adults remain the source of infection in the population. What are the challenges? The challenges is that we see developed countries, that especially development partners, the interest to support other areas like HIV, but hepatitis somehow is left alone, and yet hepatitis go along with HIV. So we need to see the interest in the partners that support, especially in infectious disease like TB, the interest that, for example, Global Fund puts on TB and HIV. We want to see that also this goes to the hepatitis B and hepatitis C. We know that vaccination is very, very important tool, and we want to see that this scaled up, but through sensitization of the community, which still up to now the risk perception of hepatitis still remains low, even when we have had deaths. What do we need? What do we propose today? As we convene today as friends of that are discussing to eliminate hepatitis B, we have 6 years to go. What can we do within these 6 years to accelerate the prevention, the screening? Because the burden, our biggest burden in the developing country is that we don't have sufficient resources to screen everyone who needs to be screened and to be treated. We need to treat, because once we don't treat, then the people who have infection continue to spread. The trick is in eliminating in hepatitis is actually massive treatment. Massive treatment, I'm talking about everyone who has hepatitis B accesses treatment and also needs to follow up. The test kits need to be available. However, this is not the interest of many developed partners that give support to the developing world. So as we set the target here, as we sit here to talk to ourselves, we need to also be cognizant of the fact that the burden in the developing country is still a big problem, and COVID taught us that we are not safe until everyone is safe. In Europe or in America, you'll be safe, but let me tell you, if you do not support, still hepatitis B will come back to us. So I think we need to sit together and work together, make sure that we avail the test kits, avail treatment, and make sure that we step up the community interventions, the community health approach to step up and get everyone tested who need to test. You saw the statistics of 2% is not acceptable at all. Of those who are on treatment, we need to accelerate the treatment. Thank you very much.
Thank you, my dear sister. And I'd like to ask our big brother, Honorable Minister of Health of Namibia, to share with us also Namibia experiences regarding challenges, but the perspectives. Dear brother, you have the floor.
Thank you very much, moderator. I ask for your apology because you know the way this arrangement is made, I need actually 3 hands, but I only have 2. Our discussion here today is both timely and essential as we galvanize our efforts to eliminate hepatitis globally. The prevalence of hepatitis B in Namibia has been and continue to be a significant public health concern. It affects more than 2% of the general population. Among the pregnant women, the prevalence is as high as 7%. From October 2017 to March 2022, Namibia experienced an outbreak of hepatitis A. Its impact was felt mostly acutely in peri-urban areas and in informal settlements, with those settlements with limited water, insanitation, and hygiene amenities. The outbreak of hepatitis A underscored the urgent need for a robust emergency response system and practical improvements to health sector public infrastructure. Following intensified intervention by government, with the assistance of development cooperating partners and stakeholders, Namibia declared the end to outbreak on the 2nd of March 2022. In other words, since that time, we never experienced a single case of hepatitis A. Success in ending the outbreak is a testament to the robust emergency response strategies and flexibility in mobilizing domestic resources, supplemented by support from development cooperating partners. Beyond hepatitis A, we recognize and embrace opportunity for alignment with global strategies to eliminate hepatitis B infection by the year 2030. Earlier this year, Namibia was recognized by the World Health Organization as the first country globally to meet the criteria for the Silver Tier Award on the path to elimination of mother-to-child transmission of hepatitis B virus. This recognition highlights our country's comprehensive healthcare strategies, including extensive vaccination program. Vaccination against hepatitis B is integrated into the routine national immunization schedule. Infants in Namibia receive a birth dose of hepatitis B vaccine within 24 hours, followed by the dose at 6, 10, and 14 weeks. Such initiatives has led to a remarkable vaccine coverage, with a birth dose coverage exceeding 90% in 2022. Namibia's progress in screening and diagnostics for hepatitis B has been pivotal. We ensure that all blood and blood products are screened. There is routine screening for hepatitis B virus among pregnant women who access or who attend antenatal care services. Despite high testing coverage, challenges such as the lack of point-of-care testing still persists. We are actively exploring new technologies to overcome these hurdles. Access to antiretroviral treatment has improved, especially for individuals co-infected with HIV and hepatitis B virus, ensuring comprehensive care and management to prevent liver damage and further transmission. Namibia has also been a pioneer in educating the public on the significance of hepatitis B prevention, transmission, and the critical importance of vaccination. As stated earlier, Namibia achieved dual recognition from the World Health Organization. It has already been mentioned by the WHO representative, being hailed for its milestone towards the elimination of mother-to-child transmission of hepatitis B and HIV. Since rolling out hepatitis B vaccination in 2009, Namibia continues to strive towards the gold-tier recognition for eliminating mother-to-child transmission of hepatitis B virus, HIV, and syphilis by the year 2028. Our journey underscores the importance of political will, resource allocation, and international cooperation. The Namibian government's unwavering political commitment, effective collaborations with multilateral and bilateral partners, and the provision of financial and technical resources have been instrumental in our progress. It highlights the necessity for sustained investment in hepatitis programming to achieve our shared goal of elimination by 2030. We believe in the power of collaboration, innovation, and commitment to promote, improve, expand, and strengthen measures that promote public health. We remain committed to leading by example, sharing our experiences with fellow African member states and the global community. Together, through strengthening health diplomacy and international cooperation, we can eliminate hepatitis and safeguard the health of future generations. Thank you, moderator. I managed.
Thank you so much, my dear brother.